It's Dr. Mankal here from Barhaven Family Chiropractic, a creating wellness center. Today's wellness tip is to show you what's going to be required to achieve mobility for life, which is the joint-to-joint movements of the body that we want you to apply every single day. It literally takes about from 5 to 7 minutes every day to start this process, but realizing what you'll do for this process will ignite your energy, ignites the health potential of your whole body by just getting your body moving. And anyone at any age, with any type of condition that can at least have mobility of limbs can benefit from this process. So here we go. So you're going to find a comfortable place in your place at home. And the first thing we're going to start with is the movements of the distal joints, and we're going to move inwards all the way down to the ankles. Realizing that every single joint has a nerve fiber that runs up into your brain. So whether you have arthritis or any other joint movements, any inflammation, this would be great to do because it's only your own body weight and your own body joint function. We're not adding any resistance here. So we'll start with the joints. So what you're going to be doing is you're going to be doing the in and out of the finger process, just moving the joints, okay, 8 to 10 times. We're going to get those nerves firing off into the joints, okay, getting fluids pumped out, reducing inflammation. So once the fingers are done, I'm going to do the wrists up and down, side to side, round and round, up and down, side to side, round and round, and again. So up and down, side to side, round and round. We can even go the other way. So again, we'll do that 8 to 10 times, okay, of the joint systems. Moving to the elbows, okay? And the elbows is kind of the little circular pattern. They pronate, supinate, so we're going to work this process, and we're going to reverse the other way. Okay? And now we're into the shoulder movements. So we're going to do sort of quick circular motions, not big ones, but quick ones backwards 10 times, quick ones forward 10 times. Excellent. Okay? Now we're going to work into moving into the cervical spine, so we're going to turn the head right. We're going to turn the head left. We're looking straight, we're looking up. Looking down, side, side. So we're going to do this again, 8 to 10 times. And these are mobility ones, so you don't have to hold them. We're actually just getting the joints to move and getting those nerves to fire. So those are the 6 ranges. So rotation, up and down, side to side. If you hear pops and the cracks, don't worry about those things. They should not be painful though. That's what I will tell you. Okay? Now we're going to move into the lumbar spine. So I'm going to turn this way. So we're going to bend forward, sticking out your bum. We're going to go backwards. Okay? So forwards and backwards. Okay? If it's painful, you should not do that range of motion. Stay away from it. So side to side motions and rotations. Rotations. We're going to move into the hips now. So the hips is that squat. We want you to stand with your feet hip width apart, so it's roughly at a 45, hip width apart, not shoulder, so a bit wider. What you're going to do is as you bend, you're going to lead with the bum and try to get that knee parallel with the hip, okay, and up. Very functional maneuver for humans to have. We've kind of lost it over the years because of all these sitting positions that we are in. So we're leading with the bum, keep a little extension of the back, okay, all the way up. If you have issues with the knees, you can actually bring a chair and just sit and touch the chair and come up. So any issues of the knees, we can use a chair to assist myself and just sit and push up with that process. So again, working 8 to 10 times, and it's not this, making sure the spine is straight as you can, lead with the bum, arch in the back, and push up. That's the hips, okay? Now, we're going to actually head down to the leg area, okay? And so we're going to be getting the knee. The knee only kind of goes flexion, extension. So we're going to get those moving, flexion, extension. If you have problems with balance, you're going to hold on to a chair, okay? Good. Knees. Okay, and then the last part, moving down to the ankles. So the toe touches, we go circle, circle, 8, 10 times. And the other leg, 8, 10 times. Come forward a bit. Okay, so we move through the fingers, elbows, shoulders, all the way down to the hips, the knees, the ankles, all the way through. And you can even do those toe joints, the same thing. Have a seat and flex them several times to ignite those nerves firing up to the body. So joint-to-joint movements, it's a requirement for health and wellness. Easy to apply at any condition at any age. All right? Hope you enjoyed this wellness tip of the week. Until then, apply wellness, live with passion.